If you are a laser operator using the 1927 Thulium or any other non-ablative fractionated laser, listen. My name is Marissa Amici. I'm a registered nurse, certified aesthetic nurse specialist for the last 14 years, skin of color advocate, and laser specialist. So we've been using the 1927 Thulium for approximately 2 years in clinic. I've used it plenty of times on myself. So I'm Hispanic, a FITS 4, I hyperpigment very easily, even though I'm fair. And we use this daily in clinic on darker skin types. So this particular patient in the photo had a 1927 Thulium laser. She exfoliated her skin around the 1 week mark, and this is what happened. So she was left with small little dots that were hypopigmented. So it's very, very important when you're doing a non-ablative fractionated laser, 1927, anything that's going to leave MENS on the skin. So MENS stands for microscopic epidermal necrotic debris. Those are the scabs that remain on the skin. So it's really important to not exfoliate these off prematurely. So you have to patiently wait for them to fall off, especially on your darker skin types and especially on lighter skin types with a little bit of a tan. So I did this on my arms. So I was impatiently waiting for them to fall off around the 3 week mark. And I did use a body scrub to try to get them off, and I hypopigmented. And this was approximately 5 months ago, and I still have hypopigmented marks on my arms. So let them be, let them fall off on their own. Lots of moisturizer, lots of cream. Try to keep the area very, very moisturized. If dry skin is going to take longer for these to exfoliate. And also, if you're a patient, make sure you're doing this weeks in advance before an event. If you're a clinician, make sure you're telling your patients, the face could take almost 3 weeks, 4 weeks for those scabs to fall off. The body can sometimes take 6 weeks. I've even seen them at the 8 week mark. So really be careful to not prematurely exfoliate these off. We've learned this over time and by trial and error. Initially, we were telling patients to just exfoliate it off, but that is not the right thing to do. So make sure you guys are waiting and letting them fall off on their own.